Hello, Dr. Jordan back with you once again for Pediatric Health Month in October. Video 1, we talked a little bit about why chiropractic for pediatrics. What are some of the things that, or what are the reasons that we take care of kids in the office? This time I want to take a little bit of time to talk about what are some of the common conditions that we see in the office. And I want to be very straightforward here at the beginning that chiropractic isn't necessarily designed to treat specific conditions, right? What I mean by that is if I have a little one that comes in who's getting chronic ear infections versus a little one who's having a fever versus another little one who maybe has colic, I don't treat that, I don't adjust them differently because of the symptoms that are presented. What I do is I look for areas in the spine called a subluxation, a misalignment of the spinal bones caused by trauma or just repetitive stress, behavior-induced things that create problems with the nervous system. And so I'm very straightforward that it's not condition-based, so to speak, but I figured we'd touch on just a couple of common conditions that we see. So the first one I want to talk about is colic. Colic, a lot of times, if you talk to other healthcare professionals, they'll say, well, they'll just grow out of it. And I tell patients, be leery of that because for a lot of times with kids, they don't grow out of it, they grow into something else. And so that colic will develop into reflux, or that colic may develop into, bedwetting problems or something like that. Like there's other issues that go on because there's an irritation physiologically going on inside the body. And so a lot of times with colic, we'll notice misalignments in either the top part of the spine or the very low back, the sacral area. And what we try to do is we try to activate the parasympathetic nervous system, kind of the calming part of the nervous system, to try to get that little one to sleep better. And a lot of times sleeping better helps not only the baby heal and recover, but it also helps parents big time. The other one that we'll often see is ear infections. And ear infections is quite a mystery for a lot of parents. A lot of times it's chronic, and a lot of times it's treated with antibiotics, which wipes out the child's immune system. But I wanted to explain a little bit about how chiropractic can help with ear infections, specifically focused on the anatomy. So one of the things that happens with ear infections is that eustachian tube becomes inflamed or it gets pinched off. And from a chiropractic perspective, what we'll see is the very top bone in the neck called the atlas. And a lot of times there's this muscle called the tensor veli palatini that's actually attached to that muscle. And when that bone, that atlas subluxates or it shifts out of alignment, it creates tension on this muscle and that'll close off that eustachian tube. And what happens is the fluid starts to pool in that area. And I tell people it's a lot like rats in a dumpster, right? So rats are they come to a dumpster to feed on the garbage because the food's there, right? So if you took away what's in the dumpster, you took away the garbage, the rats are gonna go away. But as soon as that garbage comes back, so it's not the rats being there that makes garbage, it's the garbage is there, the rats start to filter in, and it's the same thing. When there's fluid that fills up around this in the inner ear, what happens is the bacteria starts to fill into that area, and all of a sudden we have this chronic ear infection issue that starts to take place. So you treat it with antibiotics, it wipes out the bad bacteria that's causing the issue, but it also wipes out the good bacteria. So it lowers the immune system, and all of a sudden 2 months later, 4 months later, another ear infection reappears because you didn't address the issue with the eustachian tube. Another common treatment is tubes, right? Putting tubes in the ear. I was this kid. I had tubes put in. And tubes, the idea behind it is correct to open up that eustachian tube. The problem is you create an easier access for that bacteria to fill into that area. So a lot of times, even with kids with tubes, the success rate is really, really low because all of a sudden you have more bacteria getting into that area, creating more ear infections. So one of the things that we do is we use specific chiropractic gentle adjustments with pediatrics, with kiddos, to realign those areas in the spine that have subluxated and to keep them healthy and flourishing as they move forward. So if you have any questions specific to what's going on with your kiddo, we'd love to answer those for you. Our office number is 712-366-1611. Have an awesome day.